it's Naomi Sturdy. Welcome to this short little video just with a couple of tips and movements for Pilates and yoga during pregnancy. So depending on where you are in your journey, these movements will be fine. Just make sure that if you're before 12 weeks that you consult your GP about anything in relation to exercise or movement. And then other than that, once you get clearance to move and return to your exercises, all of these tips will be very useful. So the first thing we're going to look at is you can just grab like a strap or a piece of string, a TheraBand, like anything like that you can hold alongside your body. We're going to begin standing and we're just going to have a sense of assessing our posture in relation to our pregnancy. So again, depending on how far along you are in your journey, this will be different, and our center of gravity is going to start changing as we progress. So what we want to try and maintain throughout our pregnancy is that we have a sense of keeping the pelvis neutral when we're standing. So an easy, simple way to check is just to hold a strap or the string outside your outer thigh, and we want to have a feeling of running a straight line down towards your knee and down towards your ankle. So in that way, it's not like going to be exact perfect here or anything, but that like the hips aren't kinked back behind the knee or the ankles or forwards. And what can often happen in pregnancy is we get this kind of tilting of the pelvis just to support the extra weight that we're carrying forwards. But what that can lead to is a compression in the lower back, and it's kind of creating a sense of flaring in the ribs and an imbalance in the musculature at the front of the body. So we want to try and contain that and get a sense of standing in as much as possible our normal regular posture if we weren't pregnant. So leaving your strap to the side, just taking yourself standing then, getting a sense of placing weight over all parts of your feet. And this again, like the sense of how you're standing on your feet will change from week to week and month to month as you are pregnant. But as much as possible, we want to try and keep the weight even down. So feeling like that, a sense of your pelvis over your knees, over your ankles. And you can have a feeling here of once or twice, maybe exploring like how it feels to anteriorly tilt your pelvis. So that'll be like you're sticking your tailbone out behind, or posteriorly tilt, like you're drawing your tailbone down. And if you can access that movement as much as possible, pain-free and with ease, and just getting a sense of the freedom of movement there. It's not huge, but you should be able to feel a little bit of movement. And then as we explore this anterior and posterior tilt, we can get a sense then of, okay, what's center here and neutral, enough pelvis in the middle. We're going to take the arms either side, and you can bring your eyes closed here, just a couple of moments, maybe out of your day in the morning or in the evening, getting a sense of, okay, coming into your body, sensing how you're standing, like that, sensing your center of gravity and connecting to your breath. And can you imagine or sense your rib cage as a bowl from front sides to back, centered above your pelvis, and that's a bowl-shaped structure as well. So making sure we have this sense that the ribs aren't flaring forwards or sort of pressing backwards if we were rounded over, that we've a long lengthened spine, rib cage center, pelvis center, weight down through the feet. Soften around your shoulders. And we're going to take a full deep breath in here. And full breath out. So from there, opening your eyes, the next little thing we're going to look at is just a feeling of how we can start to go down towards the floor with safety, with ease, and also come back up. And this will become really important as well even when you're picking up things or bending over to grab something, just being really mindful of your spine throughout your pregnancy. So the first movement that we're going to look at to help with that is having your toes pointed forwards, having again the sense of your posture upright. You can bring a little bend to your knees here. We're just going to bring the hands to rest on the thighs. We're going to take a full deep breath in And then breathing out, we're hinging from our hips, maintaining a lengthened spine here, and lowering the torso all the way to about 90 degrees. And what we want to be really careful here is that we keep this length in the spine, just mindful that we're not like rounding the back, or we're not kind of arching and sticking the chest or ribs forwards again, that we hold this sense of even length, and the legs are helping to support us here rather than putting strain through the back. And we're going to take a deep breath in here. And then as we breathe out, we're pressing through our feet, using our legs, using that strength to help press ourselves all the way up to standing. So we're going to do a couple more like that. Deep breath in. And breathing out, hinging forwards, maintaining the length in your spine, using the strength of the legs. Deep breath in here. And then as you're ready, breathing out, pressing all the way up to standing. Let's do 2 more. Inhale. Exhale, lowering. As we reach our 90-degree angle, let's take a deep breath in. And breathing out, pressing all the way up. Last one, deep breath in. Breathing out, we're going to hinge forwards. And this is also helping create a little length, little space at the backs of the legs, which can feel quite relieving if we've been sitting down during the day. Taking your deep breath in here. And then breathing out, we're pressing all the way back up to standing. From our standing position, we're just going to take a moment or two to experience a sense of connection to our pelvic floor. So if you have something like a block or a book here, you could bring that between your thighs, so a yoga block or a regular book. Or you could use a Pilates ball, like anything that you can squeeze between the thighs here will work. We want to have enough distance between the feet to place the object inside the thighs. And then at first, you're just holding it there, keeping everything kind of relaxed, keeping your posture. And then we want to try and encourage a squeeze of that block. And as you start to squeeze, you'll feel your inner thighs engage here. You'll feel it up towards your pelvic floor. So from the front all the way through to the back, and maybe even a little squeeze of the glutes here. We want to feel like there's a kind of drawing up of the musculature, a toning, and then you can really relax. So the relaxing part is really important. A lot of women are encouraged to tone and create that contraction in the pelvic floor, but we also need to allow it to relax so that the pelvic floor can work efficiently. It needs to be able to contract and relax. So let's try that a couple more times. We're going to squeeze the block. You feel the inner thighs engage. Feeling that draw up, like almost like a feeling of lifting up from your pelvic floor from front to back, maybe a little squeeze of the glutes. And we're going to hold for 5, 4, 3, 2, and then consciously letting everything relax. So allowing it all to be at ease. We'll do it 2 more times. We're going to squeeze the block, draw everything up, squeeze the glutes a little, hold for 5, 4, squeezing 3, 2, and letting everything relax. So really allowing it to feel at ease. One last time, we're going to try and hold for a count of 10 this time, and you can rest or pause whenever you need. I'm trying to almost hold as much intensity of a squeeze as you can. So we're squeezing the block, drawing lift and energy out of the inner thighs up through your pelvic floor, squeezing the glutes maybe a little, and we're going to hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and let everything relax. Taking your block away then, just leaving it to one side, and maybe having a sense if as we return to our posture check or our sort of centering of self-standing, closing the eyes, and maybe noticing, can you feel any different sensations or awareness around the pelvis now, around the legs, the feet? And getting that sense again of centering ribs over pelvis, spine lengthened. We're going to take a full deep breath in and full breath out. From there, we're just going to do one last little thing today in relation to our posture and our standing position. And as you progress again throughout your journey in pregnancy, the breath is going to start to begin to feel a little bit more drawn upwards as we begin to have less space basically for the lungs to expand. So it may not feel as accessible or possible to get that kind of deep belly breath in yoga that you might be used to, or that kind of relaxing breath. So we can still have a relaxing breath, and how we can start to encourage and bring it into our bodies is just getting a sense of breathing around our ribs and expanding outwards, not just forwards, but out to the sides and behind. So for the last couple of moments today, we're going to take our hands to our ribs, and it's just really nourishing to get aware of this space and with our breath to kind of have a sense of ease in this area throughout your pregnancy. So we're going to bring our eyes closed. And at first, just initially taking a couple of natural breaths in and out. And maybe even noticing naturally with your hands resting there, you might notice that you feel like this natural sense of expanding the ribs outwards into the hands as you inhale and relaxing as you exhale. And then as you're ready, we're going to try and encourage that a little bit more consciously. So having maybe your middle finger touching, both middle fingers touching in the center, we're going to start to breathe out to the sides of our ribcage, and just noticing, can you bring the hands apart a little? And then as you breathe out, just letting the ribs relax back down and hands come back together. So continuing like this, and imagining like a balloon inflating outwards as you breathe in, and then releasing inwards as you breathe out. Just connecting, feeling the space around your ribs, the intercostal muscles. And then you could even move your hands a little further apart, more maybe to like the back sides of the ribs. See, can you feel your breath travel in there? And release from there. Enjoying these few moments to slow down the pace of your day. Find your breath, find a sense of ease in the breathing. Let's do 2 more rounds. And then take one last full deep breath in, expanding outwards. And full breath out. Letting your hands relax down. And finishing where we began, this return to a sense of noticing our standing posture. And nothing has to be too rigid here, like just everything quite easy, soft, relaxed, but at the same time mindful of where our center is, mindful of the pelvis, the ribs, and your spine. We're going to take one full breath in to finish today. And full breath out. Thanks very much, everyone. Hope you got a little bit of insight or benefit from this video, from those few little movements and tips. And have a wonderful day wherever you are.